Good evening, everyone. I'm Chris Fitzgerald, the Director of Animal Services. Thanks for joining us. We're going to do an overview of the Animal Services operation briefly and talk about some of the changes in programs and services. First, some introductions. Dr. Shirley Green is the Commissioner of the Department of Recreation and Human Services. Turning it over to her to make some opening remarks.
Good evening, everyone in the Rochester community. I'd like to take this time to thank you for joining us for the first community forum of 2022. We will certainly listen well to what you have to say, and we're excited that you are here with us. We're looking to gain information from you as well as share information. And so I hope you enjoy tonight's presentation. I'll turn it back over to Chris at this time.
Okay, and then I'm joined with Dr. Green by some of my colleagues from the industry. Kristen Hassan is the Director of American Pets Alive, and she's going to be moderating tonight. Kristen, it's your show now.
Good evening, everyone. Thank you so much for being here tonight. And I'm really honored. Thank you to Dr. Green and Chris for inviting me and my colleagues here to talk with you and answer any questions you have. I will just share briefly that I led open admission government animal shelters for a decade, and with intakes ranging from about 5,000 to 20,000 animals per year. And have done this work in 4 different states. And I think that in all the time I've been doing this, I realize that every day I learn something new, and oftentimes it's from folks just like you who are really out in the community seeing what's happening. And I want to welcome you here and say that I'm really looking forward to sharing more about what you're experiencing on the ground and learning more about some of the issues that you see that you believe really need to be addressed, because we certainly want to understand more. And while each community is unique, we're always dealing with pets and we're always dealing with people. And so some of the problems have similarities. And so it's our hope that myself, Dr. Pisano, who has worked to support and lead many shelters, and Shelley Simmons, who is a very well-respected leader of Greenville Animal Services and one of the most amazing people I know running a shelter today. So we're all here just to talk with you, but I want to share before we start that we don't think we know all the answers, and this is not intended to be a one-way conversation where we just talk at you. We really wanted the opportunity to answer questions. And so what we're asking is that if you do have questions or comments, that please ask those. And then what we would ask is just give us the benefit of the doubt that we're truly trying to answer them. And I think these are long conversations. Personally, I get to talk to people like you all day, every day. I have the best job in the world. So I will continue any of these conversations with you all after this. But we just ask that everybody come with the spirit of trying to understand. And that doesn't mean you can't be critical, and it doesn't mean you can't have strong comments, but we're just here really to talk and start a longer conversation. The world has changed so dramatically for animals and people over the last couple of years. And we know that we can't just do things the same way we've always been doing them, because the problem still exists and we still have so many animals entering shelters. And I just want to say that I work in Texas, which is the highest euthanasia state in the nation, where we lose 150,000 animals a year in animal shelters. So we really have to ask ourselves questions about how we can balance all the needs of our community's pets and shelter pets and create a new approach. And we can only do that together if we're going to be successful. So Chris, I will turn it back over to you now to talk a little bit about your department.
Great, thanks, Kristen. So the animal services operation, it can really be divided here into 8 functional areas. They're represented on the slide here. Animal care is the animal shelter. That's what you think of when you think of the facility on Verona Street, where our team is involved with daily care and husbandry. The animal control part of the operation we refer to as field services, and that's historically been focused on reactive response to calls for service involving animals, protection of public and animal safety, enforcement, and really a reactive kind of approach. We've shifted over the last several years to being more focused on proactive and supportive services, and our outreach and support team really sprang out of that. So now, in addition to the animal services officers providing support and trying to address root causes of issues, we also have an outreach support team that's providing door-to-door service, offering resources and access to services and care. Our foster care program is based on the principle and our recognition that animal shelters are scary, stressful, foreign environments that are not great places for most animals, and that we would prefer to have them in homes. And so in the absence of their permanent home, a foster home is a nice surrogate that is the preferred housing option. Our pet safety net program is really a subset of that foster care. Animals might be separated from an owner who's experiencing some crisis, and we want to be able to provide that safety net for them so they don't have to give up their animal permanently. So we'll take the animal in, it may be housed at the shelter, but ideally in foster care, and then be reunited with the owner after the crisis has subsided. And our transfer program is similar in that we're then working with area rescue organizations to place animals in their care, and most of them, we deal with over 4 dozen in the area, are most of them are operating with foster networks of their own. So we're really following the model of our rescue partners in trying to house animals more in homes than in the shelter. Our clinic was originally focused on animals that come into the shelter and need care. So their examinations, vaccinations, sterilizations before they go into new homes. But throughout the last couple of years, we've expanded that in recognition that our community and many communities are struggling with access to affordable veterinary care. And so our clinic now is also trying to support veterinary needs of owned pets. And then the last functional area is our client services. It's our customer services operation. So all of the adoption, reclaim, and dog licensing transactions that we do. But these are also folks that are talking to people on the phone or that are coming in. They're often the first point of contact with us, and they're trying to provide some triage to determine which pathway the conversation should go. Should the animal come into the system? Does it need some sort of intervention? Or is it perhaps better supported staying in the community? So this slide is showing you the green bars are our live release rate year over year. And then superimposed on that is the dog bite, reported dog bites in our area. So the point of the slide is a couple of things. One, to show that throughout our history, we've been working towards life-saving changes. A series of incremental changes have led us to the 90% save rate that we're at. And we've done that while supporting the safety of our community. It's also a timeline that's showing that there were incremental changes made throughout the years. And some of those going back to 2011, open adoptions, removing some of the judgment from what we did, and really lengthy adoption application process up through 5-6 years ago. We started doing more pre-surrender counseling for folks that were struggling with keeping their animals to see if we could intervene. Then we became Pets for Life partners through the Humane Society of the United States program. And that's where we really began doing door-to-door work in the community. and really the next iteration and the next evolution of our organization has been to join the Human Animal Support Services Coalition. This slide is showing you that our intakes, our animals that are being institutionalized have been progressively going down over the years. So when I started, we were at around 7,000, and now we're closer to 2,000. And that's been done through a series of changes over the years, not just in the last couple of years. Some of these programs here on the slide are the core programs of the Human Animal Support Services model, and what we're working on. So we've spent a lot of time, attention, and resources on adoptions and on getting animals adopted, but comparatively less, and not just us in Rochester, but in our industry, comparatively less on what we can do to try and get lost pets home. We know that more than 60% of the animals that come into shelters, and our shelter included, are coming in as quote unquote stray or lost animals. So if we can do more to get involved, intervene further upstream and affect more change, we're potentially preventing animals from coming in. And then some of these other programs are designed to minimize the amount of time they stay in the system. All of it, again, is based on the realization that shelters are not ideal places for animals. And so part of this is like recognizing that we get that there's confusion, and we get that there's misunderstandings or concerns, because we've been telling folks for decades that if you find an animal or you can't keep an animal, bring it to a shelter. And now we're telling folks that shelters might not be the best option, and there might be better to do some of these other things. So we can potentially dig into these different programs, but lost pet reunification is about trying to devote more time to finding the owner, and whether that's us doing it or a finder doing it, or in concert with each other. Supported self-rehoming is just assisting a pet owner who may not be able to keep their pet with keeping that pet and providing support for them, while assisting them in promoting it and getting it adopted directly into a new home without requiring a shelter stay. Pet support services are all those things that we've been doing out in the community through our Pets for Life program. And now we're trying to expand beyond just the 14605 zip code that program started in, but be able to provide access to resources and veterinary services to folks in need and underserved communities, and folks experiencing challenges. And then intake to placement is really just about pathway planning and making sure that animals either don't have to come into the system and can be routed directly into a placement option, or their stay in a shelter institution is minimalized. As I said, those are the four of the core programs, which are elements of the Human Animal Support Services. So this began as a pilot coalition, and really has grown into a global movement to transform the industry. So we are one of the blips on this map, but there's folks in, I forget how many countries, but there's thousands of animal care professionals and shelter organizations throughout the country and the world that are paying attention to and following some of the elements of the Human Animal Support Services model. We've got a couple slides that just kind of illustrate what the model is about, and I think this one helps. The old model was really based on how do you serve and support animals that come into the shelter. And there was less attention focused on outside the shelter walls and helping the community. The new model, the shelter still has a role, but it's primarily focused on the animals that are most in need of intervention, the animals that are sick, injured, or dangerous. And you really have your community as the center and the hub of your shelter system, in that so many more animals can be supported staying in the community, staying with their owners and being supported through crisis, staying with the finders who can assist with reunification. And all of the other spokes of this wheel are the various elements related to the model. Another way to look at the model is this this triangle, this pyramid, and the old system was unstable because there was so many animals that everything was coming in as an intake, and very little attention was focused on like what can we do to prevent intake, or what can we do to support animals staying with their people. And we've really flipped that over, and so the new model is saying, well, what can the community do first and foremost? So mutual aid is like, how are people supporting each other's basic needs related to animals? And then, when necessary, what supports and intervention can the sheltering system provide? So you're really, like I said, addressing more of the animals further upstream, so fewer come in. You're able to devote your limited resources to a smaller number of animals, and so you're better managing that population. You're staying within the shelter's staffing and physical capacity for care, and better use of fiscal resources. So I'm going to turn it back over to Kristen, say some more about human animal support services before we open up.
Thanks so much, everybody. And I want to ask Dr. Pisano and Shelley Simmons to also come on camera whenever you're ready. But I see some questions in the chat, and I just want to say that I really understand that it is frustrating, and you may feel upset or you may feel challenged by this conversation. And we are asking that everybody please be respectful, and we are going to honestly try to answer your questions. And I want to just make sure to be clear that human animal support services isn't doing something else instead of what we used to do. Human animal support services is a philosophy that says that it is no longer appropriate for the only service we provide to be separating an animal from its home and community. I told you, I've run shelters for a long time, and one of the things that broke my heart was the intake lobby. I would go in day after day and see people crying and losing their animals and having no other option than surrender or surrender for euthanasia. And that isn't appropriate for the world we live in, when 98% of pet owners consider their pets family. So you don't have to say HAAS, you don't have to think about human animal support services. I would say that if you're kind of skeptical, but you want to hold on to a piece of this, one way to think about it is that we're trying to build in animal services that really takes care of every pet in the community. And one of the things that's always bothered me about animal sheltering is we only ever really consider those pets that came into the shelter when we have entire communities full of pets that need our help. So we want to turn it over to questions in just a moment. And before we do, I wanted to share this wheel, which is what your shelter director does all the time. So your shelter director is always trying to balance these multiple priorities. And our communities expect all of them from us. You expect us to keep your streets safe, to provide humane care to animals, to maintain cost efficiency and get within the allocated budget, to provide live outcomes for most pets that enter, and to keep pets out of the shelter when it's possible, to keep pets in their homes and communities. And so I think what we're all moving towards is, how do we create a better balanced system so that we start to look outside just those pets that touch the shelter, and we're able to help a lot more animals in the community. I live here in Texas, where dogs are often just left in backyards. They're not addressed. Animal sheltering has never had a way to address those unless it's a cruelty or neglect legal situation. And we're aiming to change that because we care about all the pets in the community. So, but I also know that change is frustrating and this isn't easy. And so I guess if the questions that if you could ask questions that we can actually answer in a productive way. So that would be helpful, because we really want to answer questions, and we have Shelley Simmons and we have Dr. Pisano here to answer some of those questions too. So we want to turn to the questions, but we want to be able to answer things that can actually be answered. So, and I think that this is I think that we can touch on a lot of these questions, and I'm going to sort of select people that I think can effectively answer them, and then anyone else who wants to answer can. And the first question I think I'm going to ask Shelley to answer, which is, Shelley, if a community member agrees to hold a lost or loose pet, a stray animal, as part of the Haas model, and the animal bites or attacks the finder, who's liable for that?
Well, Kristen, that's a great question, and it's something that we've had our community ask as well. And we do ask people who find pets to try to keep those pets in their own community. And the liability is no different than if I found a dog and I didn't call animal control. I just decided I'm going to do the right thing as a good neighbor and go around and try to find that, that pet, its home back. And now I'm also going to take caution. I'm not going to try to go approach a dog that's acting aggressively. And in those situations, those are not the situations in which our shelter, and I'm sure Chris's shelter, is asking people to to try to keep in their community. So I don't know if that answers the question of the person who asked, but for us, liability has not been an issue. In fact, I mean, very, very few dogs are ever a bite risk for us. Even in the shelter, I mean, less than 10% of the dogs, probably less than 5% of the dogs that ever come into the shelter are animals that we would consider to be unsafe to place out into the community. So what we're doing is just asking people to do the right thing, to try, if the animal's healthy and the animal is safe to be around and you feel comfortable, try to do the right thing and get that pet back to the owner. And it's not really about because we don't want it in the shelter, it's because it doesn't need to be there. There are so many more animals that do need to be in a shelter.
Thanks, Shelley. And I want to add that in all of the communities that are engaging the public and asking them to hold friendly, healthy, lost pets, we have had very, very few incidents of any kind of harm, or there's only one incident of aggression of an animal towards another animal that I can recall in any of the shelters piloting this. But it's, as with everything we do, including foster care of pets, 65% of pets coming into our shelter are of unknown origin. And so when we adopt a pet, we foster a pet, or we ask someone to hold it, we always want to give them as much information as we have and give them a realistic set of suggestions around how to safely house that pet. So Chris, I want to turn back to you because there are a number of questions about that are popping up, and I'm going to just try to sort of summarize them. And it's about trying to reach the shelter remotely and how, what is the situation when people are having trouble getting to the right person at the shelter remotely?
So I saw that question. So first is that we do have people, our client specialists, that was one of the functional areas on that slide. We do have people that are operating the phones. There's a phone answering system that's designed to provide some responses to questions that might not need a person to handle. But in general, there's probably 2, sometimes 3 people assigned to the front desk and answering phones. And so if it rings and doesn't get someone picking up, that either means that we're not open and don't have someone staffing the phones, or they're already on one of the other 2 lines. So then it automatically goes, to an automated system, and we would need to end up calling someone back to serve them.
Thanks, Chris. I want to turn to Dr. Pisano now, who gets to work all over the country. And I have a big question for you, Dr. Pisano, which is, I'm hoping you can help us frame kind of the state of animal sheltering today, because there's some questions here about what training are they receiving? Are they getting this counseling training? And I'm hoping you can start all the way. I looked the other day, and every day I look, there's like 50 director vacancies around the country. Like, it is such a challenging moment to find anyone to lead an organization that has animal experience, and then that trickles down. So can you kind of talk about just the state of the field right now? I think it's important for folks on this call to know where we're at in this moment.
Well, thank you, Kristen. Yes, and I think that I've been in animal welfare for 30 years. And back then, for some of you in the audience, remember how devastating it was for all of us to see most animals going into shelters being euthanized. And over the years, in particular in the last 10 years, it's been such an amazing transformation of looking at other options or other ways to help animals and people. And so overall, the intake in the United States is going down. The percent of animals is being saved. And now it's common for us to see empty cages because those animals were saved. But along the way, and I was just like Kristen, a public shelter director myself. So to see that transformation and know, like, I used to think differently back then, 20, 30 years ago, we thought differently, but we know so much more. I know myself, I'm much less judgmental than I used to be. I think the pandemic has been and continues to be a horrible tragedy, but it has turned animal welfare upside down and really brought to our attention there's a better way, as opposed to having this shelter intake bias, and let's see how we can help animals in a different way. And we have the data to support it. So again, I'm happy to be here to answer questions, because if you didn't know a little bit about the background, it can be confusing. This is not about turning animals away in need, quite the opposite. It's reserving the shelter space and resources for animals with no other options.
Yeah, I think that, if I'm totally honest with you, I sat working in large government shelters. I would go home every day and just be awake all night thinking about all of the animals that were coming in when they didn't have to, all of the heartbreaking separation of animals and families. And I think that to the point of this group, I want to say firmly that Haas, nor any work that I've done, nor work that Shelley has done, nor work that Dr. Pisano has done, advocates turning away any animal in need. I think, in fact, it came from a place of believing we're not able to really help all the animals that are in need. The current system doesn't allow us to do it. We end up caring for a lot of animals that never needed to enter in the first place. And when we envisioned this, we thought if we could really focus on the animals that need to come in and care for the others in the community, what more could that allow us to do to serve pets and people? And I think we're going to make mistakes along the way. And you're pointing out a lot of them in the chat, right? Like, as this changes, animal shelters among government agencies are the most underfunded across the nation, the most underfunded. Why? Because they were built next to garbage dumps to dispose of animals. That is the history. Animal shelters were never meant to save lives. And yet we've created a whole system on top of that that is saving lives. And I guess that I want to hear, I guess that what we wanted to hear from you tonight is appreciate the comments in the chat. And like, what are your, if you could name for us, Shelley, Dr. Pisano, Chris, myself, name for us, what are like the concerns that you have? What are the things that are just really bothering you? And if you could speak, anytime you can access to vet care, yeah, that's a big one. Kim, if you want to say more about that, please do. And maybe Shelley and Dr. Pisano, I think you should just, and Chris, just jump in here. They're putting them in the chat. So go ahead and pick one up.
Let me start with access to care. This has been a major issue. It's nothing new, but the AVMA came out, which, if you know anything about the American Veterinary Medical Association, they don't really pay attention to shelter animals or animals in need. And they recently came out with a statement that said access to care is a major crisis. It's the #1 crisis. We know that 80% of American workers live paycheck to paycheck. 20% of high income earners can't pay a $2,000 veterinary bill in 30 days. So this idea of the Haas model, I think is one of the best things, or the best thing that's ever happened in the industry, because a lot of those enforcement cases that we used to label as neglect or cruelty or abandonment, they were truly access to care issues. And it wasn't because people didn't care, they didn't have the access. So we, as an industry, are really paying attention to this. As you know, your shelter here has been part of the Pets for Life program. They're doing a lot of amazing safety net work, have received grants around safety net and community programs, and will continue to do more. But the unfortunate thing that's happened during the pandemic is that we've always suffered in shelters with finding full-time veterinarians, but now the private practice industry is really struggling as well. So that's added another layer. But again, like Kristen alluded to, taking animals into the shelter who were just, there was an issue with access or something like that, and they were already attached to their loving homes. It's so important to not create these systems where that broken, antiquated system is we just take all the animals into the shelter and then panic about what to do. So there's some great models out there if you want to read about the open door veterinary care model, looking at how we can expand access to care in the private practice industry and with nonprofits as well. It's a big issue in Rochester and everywhere else in the country, I'm sorry to say.
If I could just chime in about that, Dr. Pisano, when I think you're right. One thing that I would like to add to that is that what we've seen in Greenville, South Carolina, is that as we have been able to ask and get our community to help us in keeping animals that don't need to be in the shelter out of the shelter, what we've been able to do is to be able to help more people with access to care. Our veterinarians that are usually and have historically just been completely overrun with work because every single kennel is full and you know, there's so much need with the animals in the shelter. We're now able to take those veterinarians and work with them to provide surrender prevention, you know, low cost and no cost veterinary care. So, you know, I think that this is just another great example of ways that we need to think about how everything we do and every decision we make when it comes to, you know, an animal coming into a shelter or not coming into a shelter affects something else. And if I have citizens in my community that are saying we want to help, and if the way that we can help is to foster an animal, or if it's to keep a lost animal for a couple of days and try to look for its owner, that just gives us the opportunity to help more people. And it is working. We are able to help more people. It is still a very difficult. It's still a very difficult situation because of, you know, access to care, the lack of veterinarians and the medical field in general, even veterinary technicians and vet assistants is, you know, it's hard to come by right now.
I want to just say I was part of a community cat forum held the other night with a couple of other cat experts, and there weren't a lot of folks there, and it was really an opportunity. We were hoping to talk more specifically about community cat issues. I think that conversation bears probably its own conversation with some cat experts in the room. Not that the people here aren't, but I want to make sure, since we have just an hour tonight, remember this is just a welcoming and maybe a reset conversation to continue, but I want to make sure that we cover some of the overarching issues and knowing how important the community cats issue as well. And I want to just stop and talk, Chris, I want to turn back to you for a minute, because you and Dr. Green here tonight. And I think Dr. Pisano and Shelley and I are sitting here thinking, we wish every community would have any leadership ever speak to us, period. And I can't say enough that it is so meaningful, Dr. Green, that you and Chris are here to talk to the community. And that is not to blow smoke. That's not to, I'm saying this for no other reason than you have people here who care. And I think that what was so exciting about Rochester and why we wanted to spend our time here tonight is just to say, like, you're the kind of community we want to help because your leadership's invested. And I guess I was hoping Dr. Green and you and Chris could just talk a little bit about why you are here when so many other leaders aren't in the room for these kinds of conversations.
So thank you, Kristen. Chris, I'll go ahead and start. But one of the things I want to say is, as many of you know, I'm the new commissioner in the Department of Recreation and Human Services. And last July, I believe it was, the Rochester Animal Services was moved from Rochester Police Department to the Department of Recreation and Human Services. And in meeting with Chris in the first few months, Chris has talked a lot about how he has wanted to get in front of the community to talk about the changes that have been occurring. And I see in some of the chat, people are saying, how are we going to know? How do we help? What can we learn? And so this is the first forum that we are hosting. But as we move forward, we want to educate the community. We want you to know that we're here to support you and we have work to do. Dr. Pisano is working with us to understand the operations of the Rochester Animal Services. We're also looking at how we can bring in someone to do an assessment of the facilities. We know in order to do all of the great things that Kristen has talked about, Dr. Pisano, Shelley, we need more resources. And so we certainly recognize that, but it's going to take all of us in the community to work together. As Kristen mentioned, there was a small group of people who came together specifically focused on the concerns that many of you have around cats. And we hope to be coming out with some ideas from that group to share with the community, because we do hear your voice. Your voice is important, and we want to work with you. I think Kristen said it either today or when I met with her. We're not going to always get it right, but as we're learning, we want to get it better. And the only way we can do that is working with you as the community. And I'll tell you, Chris is an advocate for the shelter. He is very supportive of trying to get it right. And together with myself and some of the experts on the panel, we want to make a difference here in the Rochester community for all of our animals. So that's why I'm here, Kristen.
You're awesome. I want to record that moment and play it for other leadership in other cities and counties. That's awesome. Thanks, Dr. Green.
Thank you, Dr. Green. I appreciate that, and I appreciate your support. Yeah, I mean, to be honest, we haven't done a great job with communication, and so I'll be the first to admit it, and it, it's not for lack of wanting to or even really trying to, but there's been a variety of obstacles, and we're trying to overcome that. So this is what we're hoping to do in terms of first steps. We're not intentionally excluding the community from anything, and everything that we're doing is really about how to better serve the community, but how to get the community engaged in those solutions together. And that's what we're trying to do is like open up dialogue, engage our community members in the work that we're doing. And there's so much common ground in everybody that's on this call, all of whether it's the panelists or the participants. There's so much common ground here. We're all committed to making a difference, to caring for animals, to making lives better to life-saving work. So there's so much common ground to focus on and mutual interests. And so I think coming up with some solutions together, some collaborations, there's collaborations that are happening that maybe you don't know about. Like we do work with Lollipop Farm on a regular basis. They're one of the clinic providers for our Pets for Life program. But not everybody knows that because we don't have to do a great job with communicating. So, there's more work to be done, and that's what we're here for.
Yes, go ahead, Dr. Pisano.
Listen, I do want to give us just a quick snapshot of community cats, just as like the overarching theme. And remember, our public officials made state laws and local ordinances decades ago with the best of intentions. What they didn't know, which we know now, is less than 2% of the cats that enter shelters, which are labeled stray, which are actually not stray, they're just kind of outside hanging out, like half of Americans allow their cats out. But if they end up in the shelter, like 80% of the cats in the United States shelters are in that category of stray, less than 2% are reunited with their owners. So we have these foundational policies that don't lead us to our goals. So now that we have that data, we can agree, well, we have to do something differently. And that differently means that we need to make sure those cats are spayed and neutered, rabies vaccinated. That benefits everybody, public health, less impact on wildlife. When Shelley started this program 6 years ago, very first year, 2,000 less cats went in the shelter, 2,000 less euthanasias. And there's less cats and kittens being born and creating colonies. This is actually colony prevention. So there's only benefits. I'll also share with you that way back when, I thought this was the most insane thing I ever heard of, but look at me now, I'm the preacher. So for your community and everyone else, it's the same pathway. We want them to go directly to spay neuter and go back. Maybe every once in a while there's a reason they have to be relocated. But right now, your spay neuter capacity is definitely a challenge. But that will always be the goal, and to use the shelter again for cats who have no other option. So I just wanted to set the tone and the blanket statement for that, which is the consistent recommendation.
Dr. Pisano, I really appreciate you sharing that. And it actually brought up another issue that I really want to make sure we talk about tonight. And that is this idea of supported cell-free-homing. So I think I was counting the other day, I think I've overseen the intake of almost 200,000 animals in my career. And one of the things that I think the public truly doesn't know is how awful the shelter is for the animals. Even the best shelter, it is the most scary, traumatizing, loud place. And cats in particular, I have a really soft spot for. Cats will stop eating and die in shelters, and it's not an infrequent occurrence. I led some of the highest life-saving rate government shelters ever in the country, and we would still have the animals die from the stress of being there. And other animals would just lose their minds. Most of the pets that we euthanize, it's because they have medical or behavioral decline due to the extreme conditions of the shelter. And so when we think about those pets entering the shelter, I guess that what I would ask you to consider with the programs we're introducing is we kind of started with thinking about the experience of the animal. And so it's supported cell-free-homing. We thought about when you surrender an animal to a shelter, you are never allowed to even know if that animal lives or dies in most cases. You are never allowed to see that animal. You have no rights to know anything. And it is a permanent and complete separation. And that system is not just inhumane for the pets, it's inhumane to the people that are forced to give them up because of whatever circumstances or crisis they're facing. And it's not good for the animals. And so when we started supported cell-free-homing, what we noticed is that people, when they were cell-free-homing, they were doing a way better job with adoption counseling, because who knows the pet better than the owner, right? And they were making relationships with the person they were rehoming to. And so they could know that pet was safe. They could oftentimes visit with that pet. And if that pet ever needed a pet sitter, they oftentimes were the pet sitter. And it was nothing that we expected. And I wanted to bring that up because Shelley has done the most significant work of any director in the country in this area. And so I was hoping she could talk a little bit about the experience that they've had with supported self-rehoming, because it's a program that you hear it and you're like, wait a minute, why are people supposed to do that? And then when you think about why it's different, it starts to mean something else. So Shelley, will you talk just a little bit about that?
Yeah, absolutely. So, supported self-rehoming is exactly what it sounds. Basically what we're doing is we're helping pet owners rehome their animals without them ever having to come into the shelter. And what our goal is whenever we do that is that we're going to provide them with the same kind of resources that we would provide an animal if it came into the shelter. But the benefit is, like Kristen was mentioning, they don't have to come into the scary shelter, and we don't have to worry about all of those pieces. And the pet owner doesn't have to worry about all of that. They get to go through the process of rehoming. And, there's a lot of things that are very difficult to deal with when you're in an animal shelter. But one of the things that's awesome is whenever you get to see a pet go home. And the same is true whenever, if you do have to go through the process of rehoming your pet, being able to be involved in that process makes a huge difference for people. When we started it about 20 months ago, we were a little reluctant. We didn't think that people would want to do it. And we were completely wrong. We have, in 20 months, we have we've published, I say published because every animal that we helped on supported self-rehoming, it goes onto our adoption website, just like an adoptable pet in the shelter is. When you go to our website and you click on adopt, you can choose to adopt a pet in the shelter or adopt a pet in the community. And when you adopt a pet in the community, it takes you to all of these people that we're helping and all of the pets that we're helping that are still in their homes, that are looking for homes, that are never going to see the shelter. And we've had 1,500 animals published on our website for rehoming this way, and 1,100, and I think the number was 1,135 as of the end of last month, were successfully adopted. We also had another 15% of them keep their pets, because part of the process is talking to them and saying, what is it that you need help with? Is there something that we can do to help you keep your pet? And we were successful that way. So really, in the end, less than 10% of the animals that we help this way end up coming into the shelter. And it's been phenomenal. First of all, it's just a great feeling to know that you're helping a person and their pet, and it doesn't mean that you have to separate them. And at first, I don't think our staff realized how meaningful that was, but as soon as we started doing it, it just makes your heart warm to see that and to know that you're helping people that way. And I have to say, the other really great thing because as a county shelter, I'm always looking at how can we save money, right? How can we best utilize the taxpayer dollars? And we have been able to save about $40,000 a month through supported self-rehoming. Now, we're thankfully able to reinvest that into other programs. That's not money we have to give back. We're able to do all of these other things that I've been introduced to through Haas or through other shelters that have Haas-like principles. And so it really is a phenomenal program. It's something that I think that every shelter should be doing. And it's a win-win for everyone. There's nothing bad about this process. We even do all of the spay neuter. So I know people sometimes are worried that the pets are going from one home to the other without them getting spayed or neutered. Every pet that goes through the program gets a free spay neuter, free microchip, free pet hub tag, all of their vaccines, heartworm tests, heartworm prevention. They get the same exact thing that they would get if they came into the shelter.
And these programs, go ahead, Dr. Pisano.
I just want to mention, for the audience, one thing that people at the beginning of supportive self-homing, people questioned, no, we have to screen these adopters or what have you. But what everybody needs to know is less than 40% of pets in American homes are adopted at shelters or rescues. And so we don't need to be the adoption police. Most people are getting their pets from other sources. So this is just one avenue whereby, like Shelley and Kristen are saying, we can save that pet from coming into a very, very stressful environment.
And I want to just touch on resources really quickly, because I work here in the South and have worked in the West too. And shelter resources, shelters are critically underfunded across the United States, period. We work with one, Dr. Pisano and I work with one shelter called Palm Valley in Texas with a 20,000+ intake. I think it's a 25,000 intake. And their entire budget is $3 million, completely. They're not only funded to intake and euthanize, that's it. And many of our shelters are still funded to intake and euthanize. And that has nothing to do with Rochester. And in fact, Rochester's in a lot better position than some, but of course, we all need more resources. And the reason we need more resources is that in the old days, when I think that government officials thought that if you give to animals, you take away from people. And what we're trying to say with Haas is, like, when you give to animals, you give to the people that love them. When you invest in those pets, you're investing in the people that care about them. And so it's a shift, but it's going to take time. And why we came here tonight is certainly not because Chris needs us to. He's a pretty amazing leader. We work with Chris all the time, but we also work with dozens, hundreds of other shelter directors. It's not that he needs us here. It's us coming to say that he's going to need your help. Like a lot of what has to happen with the community coming together. And it is frustrating. Like, I've had more fights in the last 2 years trying to create this change than ever before, but we've gotten to a much better place. And your community, what I know about it is that you all love animals. And the passion that I see every time I hear from one of you, it's about that well-being of the animals. It's not a lot of communities, it's personal attacks, it's nastiness. You're amazing. So it's like, I think that why we came here tonight is Dr. Pisano is going to be working more closely with you. Shelley and I are here to help. But what we want to say is, like, we see so much amazing stuff here and have so much pride in the work they're doing. And it's sort of our saying, like, go do it. If you're part of Haas, we can help you get access to grants that can support a lot of this too. So that's really kind of what I think we wanted to say. And Chris, I can see you and Dr. Green both are waiting to speak, I think.
I'll go unless Dr. Green, do you want to? No, I was trying to keep up with the conversation and the chat. There's a lot of feedback. There's a lot of questions. I mean, this is really what we were trying to do, is engage the community in being part of solutions. And so there's people asking questions that a lot of them are right on the money, that there are things that we need in terms of new facilities. There could be more collaborations. And there's other things that are questions where, folks didn't know that we were involved with certain things, or didn't know that we provided veterinary care to community members who are struggling. So this is exactly what we were hoping for, is to start to spread the word, to open up the communication lines. And when there's concerns, like we need to know about them. And in most cases, I don't hear about them. Somebody tells me that somebody is expressing a concern somewhere else. But rarely are folks contacting me and asking questions. So, like, this is what I'm hopeful for, is that we open a dialogue and we keep communicating. We find ways to do that, and we find ways to engage each other, because, like I said before, we're all trying to work towards many of the same goals.
Kristen, I just was coming on and as we're coming to a close, I just want to thank the community for coming out. So I know many of you have sent emails and sent questions to various people. And so we wanted to make sure that we were here for you. Chris has shared the email address, and Chris, you may want to put it in again. So that for those of you who are trying to reach out to the shelter, I see some very specific questions where you may need help. and this forum is not the place for specific questions, but I would encourage you to send the email to the Rochester Animal Services so that you can get the help that you need. I appreciate where I see someone who is taking in an animal, a pet from someone who is unable to. So again, we appreciate the outreach that you're trying to do. And I'll tell you, when we're not doing it right, we need your help so that we can get it right. We are committed to this work. I've said to Chris and his team that I'm here to support him and everything that they're trying to do. I see several people have talked about the actual facility. We recognize that, and we will be doing a study, I believe, in the next 18 months to see what we need to do, so that if we're going to say we're going to serve the animals, we need the space to be able to serve them. And so we're working on all of those things. And certainly Dr. Pisano's information that she will share with us will help us even get better at this work. But I just want the community to know that we appreciate you, we hear you, and we want to work with you.
Last words from Dr. Pisano. I know you all have like some last nuggets to leave us with. So can you just say what else do you want to make sure this group knows tonight before we leave here?
Well, I just am so thrilled that people join a meeting at 7 p.m. about animal services. It makes me so happy to know that people care. And the more you know, the better you can do. And the more you understand the goals and the good intentions of the department, everybody can work as a team. So thank you for joining us tonight. We really appreciate it.
And I'm just going to say something specific about Dr. Pisano, because I know that she's working with your city, and I can tell you from experience, she came to our shelter and our community 6 years ago, and it completely changed the way that we look at animal sheltering, the way that we help animals. Our community is so much more supportive because of the things that she suggested and that we implemented. And you know, it was hard. Some of the things that she was asking us to do was hard, but it was a leap of faith for our entire community, and it has paid off. We went from a shelter that was taking in 20,000 animals, 15 years ago, to a shelter that's now taking in 7,000 animals, and a fantastic TNR program, a great supported self-rehoming program. It's just so many good things have come out of it. So I think, Chris, he's an amazing guy. Dr. Pisano, I think you guys are all in good hands.
Thank you.
Chris,
Thank you.
This is your baby. You've been here a long time, and you've been through so much and taken the organization so far. I think it's appropriate that you close us out tonight. So what last words do you want to share with the folks who came to this call?
Well, I'm glad that you came. I mean, that's like, first and foremost, I'm glad you're here. I'm glad you started communicating. We started communicating together. I am committed to the city of Rochester, this community, and this mission of serving people through animals. So I'm here, I'm committed, and I'm open to hearing from you. So, and then I put in the chat, anybody whose question didn't get answered, we'll try and go through the chat, make sure that we get those questions answered and posted to the city website. Thank you so much to the panelists too, and then for everybody attending. Dr. Green, for your support.
Yes,
I appreciate
thank you.
that. And thanks the interpreters for being here too. I know it was last minute, so we appreciate you.
Thanks so much, everybody, and thanks for having us tonight. And we'll be happy to come back anytime.
Thank you, everyone.
Good night.
Bye-bye.
Thank you.
Good night.
Bill, you ended the